Katrina, you mentioned before that these workshops were appropriate for younger audiences. Are they also appropriate for older audiences?
Absolutely. Like I said, we tested this in the adult population with a range of ages. We didn't have a specific senior site that we pilot tested in, but I certainly believe that a lot of these messages could be utilized in the senior community, within older adults, and a variety of groups. We had parent groups involved, Head Start groups, and so I think anyone in the adult population would be a great target for these workshops. And I know I've seen a few questions, people asking about family involvement. And now while the handouts and things, as I've mentioned, we're geared toward adults, but this may be something that teens could come with their parents, or that the family could be involved with this as you're teaching the lesson. So we encourage you to kind of experiment and find what works in your community to help meet the needs. A lot of times we focus on adults because sometimes they're the decision makers. But I really feel that a lot of these messages could be used in a lot of different communities and a lot of different populations.
So, Katrina, a little bit of a follow-up to that. Someone would like to know if you have to teach all 6 workshops, or if you can be selective and teach one workshop here, one workshop there.
Great question. So for pilot testing, we really developed each of these 6 workshops to kind of lead off of one another as a full series. And so we asked all of the pilot instructors to teach the full series of workshops. But we've heard from a lot of people since then who have started teaching them that they only have time to teach 1 or 2 or a handful of workshops, or like the example I said previously about the faith-based community that is starting with workshop 4 and then going back and starting with 1. So each of these workshops are standalone. If you have an hour to teach a lesson, that a group is focused more on, let's say, healthy weight, you may want to just teach workshop 4. Or if you're dealing with a group that you just want to teach some physical activity components to, you may only want to teach workshop 6. But the way we did pilot testing was to try to see if the full series as a whole would be helpful in helping participants be motivated to make some behavior change and increase their knowledge. The other reason why there's 6 is that, as many of you know, there's a lot of components when it comes to eating well and being physically active. And so we felt like we really needed to spread it out over multiple sessions to be able to provide a variety of tips and resources. So I think it just depends on the community that you're working in and the time limitations that you have. Like I mentioned, each of the workshops are approximately set up to run for an hour. We did have some community sites when we were doing pilot testing where there was lots of questions and lots of participant involvement, and some of those sites chose to spend a little bit longer than an hour. But in general, each of the lessons can be taught start to finish with the handouts for about an hour.
Sarah, along those same lines, if you could just choose one workshop to teach, what would that be?
That would be difficult, but I think I would select the Eating Healthy on a Budget. And like it's already been mentioned, really, you are only limited by your creativity and personal stamina. There are so many ways you could expand upon the program, and yet from the same looking, each one of them could be done independently. One of the things that was the initial activity that we did for that lesson was doing the taste testing as was suggested, doing generic store and name brands of canned fruit. And then we went a step further and we had them taste it. And then once they tasted it and they kind of identified which one they liked the best from a taste standpoint, we actually had priced all the items and went through and did some information on unit pricing, and so kind of expanded on it from that. We also distributed like grocery store flyers and had them do a weekly shopping plan menus and did some planning a grocery list, looking at the specials for the week, what they would pick from different food groups, and the participants really seemed to enjoy those activities.
And a little bit of a follow-up to that, did you charge for the workshops, or did you have any questions from potential participants about how much participation in the workshops is?
No, actually, that's a very good question, but actually I did not charge any for participation in the workshops. That might be something I would consider if I wanted to continue to include incentives to increase participation, or I would also consider working with other community agencies that maybe they could provide some resources, I could provide some, and they could provide some to not only increase participation but also be able to provide incentives that I couldn't provide by myself.
That's great. And we're nearing the end of our hour. So, Katrina, do you have anything to add or any final comments you'd like to make?
Sure. Just following up on Sarah's comment, because I've seen a few questions about the cost, and I just want to remind everyone that the community workshops that we put together is a resource coming from the U.S. Department of Health and Human Services. So we're providing this guide and the workshops really for all of you that are out at the community level to be able to teach from the Dietary Guidelines for Americans and the Physical Activity Guidelines for Americans. So there is no fee to use the program. We encourage you to download it, print it, copy it, hand it out, and use it the best way it works within your communities. Like I mentioned, we were able to provide the pilot sites with a small stipend to help cover the cost. And Sarah also mentioned that she's applied for 2 grants to be able to teach the workshops in the spring. And so that might be something that you all think about applying for a grant, or to see if your organization might have a small amount of funds or perhaps even donations within your community to be able to teach it. You'll notice if you look through in the appendix, there's actually a list of supplies that may be needed to teach the complete series. And so that may help get an idea of what's actually involved. Things like one of the taste tests that Sarah had mentioned about trying to determine the difference between a generic canned fruit versus a brand name canned fruit. So that would require purchasing a can of generic brand fruit and a can of brand name canned fruit, things like that. But I think that'll help give everyone a sense of what may be some of the financial costs if you want to teach the workshop with all of the taste tests and the added components. And if you're able to do so, we felt that they added a lot to the workshops, providing kind of some more hands-on and letting people actually try some new things out.
Well, thank you. And again, thank you to Sarah and Katrina both for the fantastic information you shared this afternoon and for sticking around and answering some questions that our participants asked. Also, thank you to everyone who joined us this afternoon, and we hope you're encouraged by the information we shared and are going to go to our website and download all the materials we discussed today. Again, our website is health.gov/dietary guidelines, and you'll see the direct link to that on this last slide. Also, a reminder, we'll be sending out an email following the webinar, and that'll give more information about all of our materials, how you can order print copies of the Community Workshop Series for free, and how you can access these slides as well as a recording of the webinar on our website in the future.